Britain has shown how grateful it is to have this facility of caring for our sick and our needy when we most need it. But if we don't step up to defend it, realize the ways in which it's being challenged, whittled away, eaten away, I'm afraid to say that we're going to be left with a system which looks very much like the US system. And if we look at just how that COVID pandemic is running rampant, out of control in the United States, you realize just how inefficient it is. It's the most expensive healthcare in the world, and it's the most inequitable, and leaves a vast number of the population, at least 60 million people, without any healthcare whatsoever in the richest nation on earth. And that is not a model of healthcare that we want to see. Our healthcare is no longer run by the government. It's been farmed out to a quango, a quasi-autonomous non-governmental authority led by Sir Simon Stevens, and that's NHS England. And it's NHS England that we recently found out this week was actually watching the figures, which had issued instructions to discharge patients with COVID from hospital into care homes to create beds in the NHS. And they became aware, and they were watching an increased rate of infections within care homes. And during this pandemic, they say 66,000 people have died within care homes. They say 20,000 of them from COVID, but many of those will be without testing, so that numbers could be far more. So there's gross mismanagement. It's not, the management of the NHS is not being run by the clinicians. There's a constant mantra every time they introduce a new wave of privatization that is about clinical excellence. It's about putting clinicians in control. But I'm afraid it's a gross lie. Funding has been put out to clinical commissioning groups. Those clinical commissioning groups are groups of GP nominally, but they don't have the capacity to plan. They're increasingly put with groups such as KPMG and the big four accountancy companies, and American insurance industry, particularly United Health, is being invited in to oversee and run that, and is being driven very far down the line of privatization. It's up to the British people, really, to prevent that from happening. And the first step to that is an increased knowledge and vigilance, George.